worsening or anything like that?
Right now, we're not getting any elevated levels that indicate concern.
Fears about air quality were officially laid to rest by Environmental Protection Agency Administrator Christine Todd Whitman.
Well, if there's any good news out of all this, it's that everything we've tested for, which includes asbestos, lead, and VOCs, have been below any level of concern for the general public health. Obviously, for those who are down here, these are very important.
But those early assurances would be called into question by scientists like Tom Cahil, a physicist at the University of California, Davis, who specializes in atmospheric science.
The initial measurements that were made were not very adequate. As the data started coming in the middle of September and late September, the EPA and other groups had much more important information that should have changed that judgment, and they did not. So the sampler operates by taking the air in.
Working independently, Cahil and a colleague collected air samples from Lower Manhattan in the fall of 2001.
So it separates the particles by size as you go along, and finally they represent the finest stage, which goes into your deep lung. The first point to make is they were talking really about two events. The first event, what happened when the buildings collapsed. An enormous plume of dust blew through the city and lasted for a short period of time, but it was a horrendous amount of material in the air.
The tower's sudden collapse filled the air with glass shards, cement particles, and 4 million pounds of asbestos.
Come on, let's go!
But the worst was yet to come.
The pile started to smolder, and all the materials that were stuck in the computers, in the electrical cables, in the glassware was gradually evolved and made a very nasty mixture of fine particles and acids. People working on the pile and near the pile then breathe for the next months. Certain particles, ultrafine particles, if they're insoluble, go deep into the lung, into the vascular system, into your heart.
Those working closest to the pile were inhaling a steady stream of known carcinogens like dioxin and benzene. But they were also exposed to a bizarre and unprecedented mixture of smoldering heavy metals.
The X-ray samples are placed in the X-ray beam at an angle like this. And the things that were startling were things like vanadium, nickel, number of elements, lead. We saw 1,000 times more vanadium in the air of the World Trade Center than we'd ever seen before in the world. We have very little data on exactly how bad these things are, how long term. But we've sampled air in Kuwait, we've sampled air in Beijing. Nothing was as bad as we had at the World Trade Center for that first month.
This is an unprecedented disaster.
Dr. Robin Herbert heads up the World Trade Center Medical Monitoring Program at Mount Sinai Hospital.
At this point, the most common physical health consequences are what we call disorders of the aerodigestive tract, and that's a fancy word for upper airway, which is the nose, sinuses, throat, and then lower airway, which is the lungs, and then that's also associated with digestive problems, particularly GERD, gastroesophageal reflux disorder.
I want you to swallow for me.
We also worry that certain exposures can cause health effects farther down the road. We know that responders, or at least some of them, were exposed to a mix of cancer-causing agents. So we feel that the responders, those who were exposed, really need to be monitored very carefully.
Today, Dr. Herbert and others in the medical establishment are still reluctant to make direct links between 9/11 and specific cases like John Walcott's leukemia or Gary Acker's multiple myeloma. And that's in large part because the doctors have never seen a group of people get so sick so fast.
If you're exposed to only benzene, and benzene causes leukemia, you're going to usually get cancer 20 to 30 years later. There's going to be a latency period.
But the old rules of latency may not apply to 9/11, where a number of toxins were working together in concert, a condition known as toxic synergy.
What toxic synergy science tells us that when you add the toxins together, when you have the benzene plus the asbestos plus the lead, that you have what's called the acceleration of disease states. It's a toxic synergistic speeding up of the disease process. So the latency period is shortened. So instead of seeing leukemia or blood cancers, or any types of cancer actually, in 20 to 30 years, you're going to see them in, the mice studies said, 3 to 5 years, and that's exactly what we're seeing.